Hi, my name is Shao Zhang, and I am a PhD student at Northeastern University. I'm excited to share our work, Rethinking Human-AI Collaboration in Complex Medical Decision-Making, a case study in sepsis diagnosis. I'm honored to have completed this work together with collaborators from Northeastern University, MIT, The Ohio State University, and RPI. We have seen recent studies in the HCI community that have demonstrated how we can design an AI clinical decision support system, refers to AI-CDSS, to help clinicians make diagnoses, including using mortality prediction model, harnessing literature to provide support, involving computer vision technology to predict cancer grade and give diagnosis recommendation based on patient's EHR. Such a common AI decision support usually occurs at a step where the doctor makes the final decision, providing diagnostic results from AI. But the complex medical decision-making process, before making the final decision, clinicians usually make hypotheses based on the patient's condition, then collect more information based on the hypothesis to verify. This leads to a problem. Clinicians do not receive support throughout the entire decision-making process before making the final decision. When the goal of AI-CDSS is to reduce the burden on human experts and improve the accuracy of decision, can such an human-AI collaboration paradigm truly achieve this objective? To answer this question, we explored the scenario in sepsis diagnosis. I will first introduce the context of sepsis diagnosis as a complex medical decision-making scenario. What is sepsis? Sepsis is a severe, life-threatening organ dysfunction known of its high mobility, fast development, high uncertainty, and high mortality. According to a report by WHO, sepsis occurring in healthcare setting is one of the most frequent adverse events during care delivery and affects hundreds of millions of patients worldwide every year. The early diagnosis of sepsis represents a common but underexplored decision-making scenario in the real world. It requires human experts with specific domain knowledge to cope with high uncertainty and to make a high-stake and time-sensitive decision based on the insufficient information. So how does the current AI-CDSS human-AI collaboration paradigm perform in sepsis diagnosis? To better understand how do human experts think about such AI-CDSS in sepsis diagnosis scenario, we begin our research with an open-ended semi-structured interview as a formative study. All 6 participants are active physicians or nurses working in departments where clinicians most likely encounter sepsis patients. We hold 6 sections, with each lasting 35 minutes on average, to gather information on their daily practice of sepsis diagnosis and their user needs and experience with the current sepsis module. Although all the participants, in general, welcome the future of having more AI support in their decision-making, they strongly believe that the current sepsis model is not only useless, but also leads to additional meaningless work. Their dissatisfaction mainly comes from the risk prediction score being late and incorrect. As the P6 suggests, so the big thing is that if we went 3/2 for our ED patients, we would be usually like 3 or 4 hours behind the human diagnosis cases.
And as well as the lack of explanation and actionable insights, as the P2 said that. I just look at the color and I just go through the human algorithm that I've done years to do the diagnosis. Besides, human decision makers feel challenged or even intimidated by the AI system due to a wrong focus on AI being a challenger of their decision-making process. As the P5 said that the AI module tries to make a decision and tell me that this patient might have sepsis. So I have to do everything I'm supposed to do for treat them. That doesn't help. Based on these findings, we can know that only focus on the final decision-making stage cannot improve the decision-making of human experts. Yet, physicians often find the AI prediction too late and not helpful, forming a competition paradigm. We need to pay attention to the intermediate decision-making process. To solve this problem, we propose a new human-AI collaboration paradigm, where AI supports earlier stage in the medical decision-making workflow to provide actionable insight and counterfactual information instead of making a blunt prediction for the final diagnosis decision. We design and implement SepsisLab, an AI-powered module for sepsis diagnosis support. SepsisLab can generate prediction of the patient's sepsis on-site possibilities now and in the future. The most important functionality of SepsisLab is suggesting additional lab tests and provide counterfactual explanation of the lab test recommendation. Now I will show you how SepsisLab provides support in the intermediate stage of the diagnosis. At the first stage, when clinicians generating their hypotheses, SepsisLab can provide the risk score from now to the future, including the uncertainty as the additional information to the clinicians. Moving to the second stage, SepsisLab can provide the lab test recommendation to help clinicians gather more data. Based on the algorithm uncertainty, SepsisLab will provide a counterfactual explanation of each recommendation, which is shown in the red area in the prediction graph. The explanation represents how much the selected lab test can reduce the model's uncertainty. Clinicians can explore the potential group of the lab tests to find the most valuable one. The algorithm detail can be found in our paper. After the clinicians get the results, SepsisLab will update prediction and recommendation for hypothesis testing. The clinicians can better verify the hypothesis with this additional information. Finally, the clinician will make the final decisions by their own without any AI suggesting diagnosis results. In the follow-up user evaluation study, we recruit the same 6 participants in the formative study and perform a test with our system. After participants navigate the interface, especially the new module, we conduct a 30-minute semi-structured interview and ask for the comments and suggestions. Overall, participants give a very positive comment on our system prototype. With AI shifting focus from the final stage prediction to the intermediate stage, the participants think that our new human-AI collaboration paradigm can enhance the human-AI collaboration experience and make the AI more cooperative. Meanwhile, participants also like our new functionalities, including lab test recommendation and counterfactual information, which went beyond the risk score prediction. The participants think that this functionality can be helpful in reviewing more information, providing actionable insights, and improving AI's transparency.
In our paper, we discuss many implications of this result. I want to highlight a critical point. Our investigation into the human-AI collaboration in diagnosing sepsis showcases that a problem in the current AI CDSS, which is prioritizing the final diagnosis result over meaningful support in the decision-making process. Our research indicates that while aiming for precision, such models fail to facilitate effective collaboration between human and AI, often leaving medical professionals feeling undermined rather than supported. We propose a shift towards a model where AI is in the intermediate stage of the decision-making process, position AI in an appropriate place to effectively support the expert's decision-making process, while not influencing the clinician's decision-maker role. This approach has a unique form of communication and collaboration between human experts and AI by providing actionable recommendations. Our study opens up fresh avenue to the integration of AI in healthcare, emphasizing the collaboration over replacement. To learn more about our design implications and directions for future research, I encourage you to refer to our paper. But for now, I'd like to thank all the clinicians, staff, and fellow researchers who made this study possible. And please reach out by email or at the conference if you'd like to check. Thank you.